Hi, my name is Dr. Jolene Andrick. I'm a facial, plastic, and reconstructive surgeon. I work with Aurora Advanced Healthcare. Today I'm going to talk to you about aging of the upper face and how it contributes to tired eyes and how we evaluate that and how we can fix that. Aging of the upper face is largely a factor of how the brows change and how the upper lids change. Many individuals assess themselves and know that their eyebrows are droopy or that there's sag on the side of their lids, or they actually see the extra skin. Sometimes they feel like their eyelids are very heavy or they feel very tired. Sometimes even the extra skin of the eyelids becomes very irritated because the extra skin is folded on itself. I look at three things for the eyelids. I look at brows, the eyelid skin, and the eyelid margin as to where the eyelid sits according to the pupil. Each of those things can contribute to aging and fatigue, but an individual might just have brow droop, somebody might just have eyelid droop, or just extra skin. So there might be a combination of 1 to 3 things that are changing. Usually when somebody notes that they have extra skin or there are changes that are occurring with aging around their eyes, they usually feel very tired during the day. They may not be able to use the computer for a long time. They might not be able to read for an extended period of time. Often they'll feel heavy, or they often put their fingers underneath their eyebrows and lift them up and say, "Boy, I can't believe how much better I see right now when I actually do that." So they actually realize there's a mechanical barrier to what they can see and can't see, and they physically can lift that out of the way and realize they can see better. An assessment of the eyebrows and eyelids is done, and we assess where the eyebrows are. We also then assess how much extra skin is involved. Lastly, we assess the eyelid margin. When an eyelid actually covers more of the iris or the colored part of our eye, or extends to the pupil, that's called ptosis. Insurance or Medicare will cover the procedures, such as the brow lifting or removal of eyelid skin, but an individual has to show that need, which will be supported by the tests that they take and by the photos in the doctor's exam. Depending on what an individual needs, an individual may have a procedure that is done simply in the office, which might allow for elevation of the eyelids or removal of extra skin. Some individuals choose to do that in the office, and some would like to have a little sedation to make them comfortable. When an individual typically has brow elevation, they do have a little mild sedation in the OR, but any of those 3 procedures can be combined together. So if an individual has a brow elevation, they would typically have that in the OR under mild sedation with eyelid surgery to remove the extra skin, and they're all done together at the same time, and both eyes are done together the same day. I usually discuss the issues about medically necessary eyelid surgery with individuals in a consultation. I'm happy to see individuals at all 4 of my offices, but they usually call one number, which is 262-387-8202.